CGM, especially flash CGM, is often prescribed to patients with diabetes, especially in patients treated with basal-bolus insulin therapy. We made a study in order to evaluate acute event as hospitalization for diabetes event in patients with type 2 diabetes treated with basal-only insulin therapy. With this social security database, we were able to individualize 6,000 patients with type 2 diabetes treated with basal-only insulin therapy, and we made the comparison of the number of hospitalization 1 year before flash glucose monitoring prescription and 1 year after and 2 years after this prescription. We observe a huge reduction of hospitalization for ketoacidosis, around 60%, and a 40% reduction of hospitalization for severe hypoglycemia 1 year after flash glucose monitoring. And 2 years after, we observe a 70% reduction of ketoacidosis, suggesting that this improvement is sustainable 2 years after. We were able to evaluate the evolution of our population according to the way of prescription by GP or specialist. And we observe the same reduction of hospitalization, whatever the way of prescription. We were also to evaluate the evolution of the treatment of the patients. And 1 year after and 2 years after, we observe a huge increase of patients treated with basal-bolus insulin therapy, suggesting that flash glucose monitoring is able to fight against clinical inertia by the physician. So finally, this study strongly suggests that flash glucose monitoring is a tool able to improve clinical events as hospitalization for ketoacidosis or severe hypoglycemia in patients living with type 2 diabetes treated with basal-only insulin therapy, whatever the way of prescription by GP or specialist. And this improvement could help the physician to fight against the clinical inertia.